So I'm going to talk about the light tissue interaction for laser treatment of vascular lesions. I have no disclosures. The goal of the laser treatment of vascular skin lesions is to destroy the subsurface blood vessels without damaging the normal overlying epidermis. Now, how we do this, we talked about it a little bit in the last plenary session if you were there. The first thing we need to do is to use wavelengths that are highly absorbed by hemoglobin. Typically for most clinical procedures, that's the green and yellow wavelengths. We don't typically do the blue wavelengths because they're too superficial and are scattered. But as I'll show you a little bit later, we can use some of the more deeper penetrating red and near infrared wavelengths of all. The second thing we need to do is to match the pulse width with the vessel size based on the concept of selective photothermolysis, where the thermal relaxation time is directly proportional to the square diameter of the target, and I'll come back to that in a few minutes. As was alluded to in the last session, you always want to use the largest spot size you can, because when you use larger spot sizes, you get a higher subsurface energy density, which makes the treatment more effective. And then finally, you need to give it sufficient energy so that you can successfully coagulate the blood vessels underneath the skin. So all these treatments are based on these four simple principles. Now, there's a variety of skin lesions which are amenable to laser therapy. My colleagues on the program will discuss those in the subsequent presentations. However, there are basically three things that you need to ask yourself when you see a patient with a vascular lesion. Number one, what is the vessel depth? As was discussed in the last session, if you've got deeper vessels, you will need longer wavelengths of light to successfully coagulate those blood vessels. Also, it's helpful, again, to use the larger spot sizes to increase that subsurface energy density. As I alluded to, the concept of selective photothermolysis, if you've got larger blood vessels are the target, and I'll show you some videos of this in a few minutes, you've got long thermal relaxation times, therefore you need longer pulse durations of the laser. When you've got very small blood vessels are your target, those have short thermal relaxation times, and therefore shorter pulses are used. And then finally, what is the patient's skin type? All the wavelengths that are used to treat vascular lesions do have some absorption by epidermal melanin. And darker patients have more epidermal melanin, and therefore you've got to be more cautious on those types of wavelengths and use longer wavelengths to get around that melanin absorption as it goes off into the near infrared. And then epidermal cooling is absolutely essential, be it use it by triogen spray, air cooling, or contact cooling. Now, there's a number of different optical devices which can be used for the treatment of vascular skin lesions. They're listed in here. You can see the wavelengths and the pulse durations. You can also use intense pulse light, which has a very, very broad absorption in the green all the way out to the near infrared. That can be very, very useful because it has very, very large spot sizes. I particularly like that for the treatment of poikiloderma. But the one thing people ask is, can I get good results with each one of these devices? And the answer to that question is yes, you can. You need to pick one of those devices. You then need to do some kind of an internship or a preceptorship with Dr. Geronimus or Dr. Kelly or one of the other experts on the panel so that you can learn your endpoints. I mean, the goal here of what you really want to become is an endpointologist so that you can actually perfect your technique so that you can get consistently good results with the device that you have. So in terms of being an endpointologist, this was discussed in the last section. This is me doing a laser treatment on a child with a vascular Port-Weinstein lesion. You can see the treatment parameters there, which were identical to what Dr. Geronimus talked about in the last session. But the thing to know is the pulse duration there, you see 1.5 milliseconds in red. And because you're using these very, very short pulse durations of the laser exposure, you're going to see the purpura. And so when you're treating infants and young children with vascular lesions, that purpura is going to be essentially your endpoint of the treatment. If, however, you're treating somebody who's got a large target, this is somebody with blood vessels, facial telangiectasia, the pulse dye laser again being used, but if you look down here at the parameters, you see the 20 milliseconds in red because you've got a larger target here, You have a longer thermal relaxation time. You need to heat that target up for a longer period of time. And your endpoint should essentially be blood vessel disappearance, or sort of a gray gun color sort of pencil fragment inside the blood vessel. I love doing these patients. This is the easiest thing you'll do that day. You have the fellow do it. You sit and check your email in the corner, and you can just come back and the blood vessels are gone completely. Now, what if you need to get deeper into the tissue? You can move out here into the red portion of the spectrum. The Alexandrite laser can be a very useful device. However, note that the absorption goes down as you move out here into the red wavelengths. Therefore, you've got to use higher energy densities. So this is a patient being treated with an Alexandrite laser, and to compensate for that lower absorption by hemoglobin, you've got to use higher energy densities. So we're no longer talking about 7.5 joules per second, we're talking about 60 joules per centimeter squared. Also notice that the dynamic cooling device parameters were increased because you're coagulating a large volume of tissue, and for patients who've got these thicker nodular sort of hypertrophic types of port wine stains, these can be very, very useful for treating these dark purple sort of types of lesions. Now finally, if you've got nodules, or you've got, again, thicker nodular hypertrophic port wine stains, you can move out here into the near infrared. Now again, the absorption by deoxyhemoglobin is going to go down, so once again, you've got to compensate for that by using higher energy densities. And so I started off at 7.5 joules in the yellow portion of the spectrum. We moved up to 60 in the red portion, and now here, as we move out into the near infrared, you can now see, because of that less absorption by blood, we've got to compensate by using higher energy densities. But these wavelengths, the ND-YAG, again, increase the cooling to compensate for the higher energy densities. These can be very, very useful for thicker nodular hypertrophic port wine stains. They can be also very, very useful for deeper vascular lesions in this tissue. This is an example of a patient who's got a venous malformation. Again, this is a single treatment where you take the energy density, increase it up to 110 joules per centimeter squared, increase the cooling, and you can see that in a single treatment, you can flatten and smoothen out those venous malformations. So I hope you enjoyed my talk. I enjoy learning about vascular treatment of skin lesions, and I look forward to interacting with as many of you as possible during the question and answer session. Thank you. And hopefully I stayed on time.
That's perfect.